To the article analysis, Children with Special Educational Needs in the Netherlands, Numbers, Characteristics, and School Career. Authors Vanderveen, Smeets, Derricks, 2010, from the journal Educational Research. I'm Christine Fisher, doctoral student at the University of Northern Colorado. Introduction. Children with special education needs, or SEN, should be allowed to study in mainstream schools to enable them to develop at the same rate with their peers. Several barriers have slowed down the efforts to offer appropriate education to students with SEN. Teachers have the upper hand in deciding which students to attend special classes and who to remain in the mainstream classes. Cognitive problems seem to be an appropriate gauge for special needs compared to physical problems. Most research studies on SEN do not explain the methods that teachers use to recognize children with special needs. There is a need to consider how teachers select children with SEN to enhance their literacy and numeracy skills in mainstream schools. Although inclusion does not happen without encountering challenges, the Dutch government should develop policies that would minimize costs of handling students with special needs and strive to know the exact number of students with special needs. Many schools in Europe have embraced inclusion of children with SEN in mainstream school to avoid instances of prejudice due to physical and social disabilities. However, several barriers exist in the provision of SEN. Some of those barriers include the lack of exact number of students that require SEN, the lack of suitable definition of SEN, inadequate funding, the lack of individualization of students, stereotyping and insensitivity. And finally, teachers have the power to decide on what behaviors that could necessitate SEN. Learning difficulties carry more influence on referrals to special schools than behavior issues. Provisions of SEN have never been an easy task in the Netherlands. A research was carried out among 8,237 students to determine students' problems that could amount to referral to special education. The research concluded that no single problem was sufficient to necessitate a referral, as students elicit different problems depending on teachers' report, school size, and overall performance of mainstream classes. Inclusion of SEN students in regular schools have gained popularity in most European countries due to its capacity to enable equal level of literacy among children. The Dutch government prefers to incorporate students with SEN in mainstream schools rather than meet their needs disjointedly to avoid unnecessary spending. Teachers' characteristics, students' behavior, as well as schools' composition have an effect on the performance and choice of careers among students with SEN. Lack of resources to handle SEN students necessitate teachers to make hasty reference to special schools. An evaluation of the article. The article focuses on how students with SEN can integrate into mainstream schools without necessarily spending too much on establishing special needs schools. Having teachers with positive attitudes can assist in literacy and numeracy attainment without discrimination. The study has utilized open questionnaires with numerous questions to exhaust the topic of inclusion and special needs. Literacy and numeracy are some of the most critical life skills that children learn in schools. Children with literacy and numeracy difficulties are easier to notice because such difficulties occur in early life. Use of multi-level regression analysis in the study of differences in SEN has helped in generalizing the results. The study has been used to compare performance of individual children with the rest of their classmates. SEN and the referral. The lack of comprehensive understanding of the types of problems that can lead to a referral has affected the study of inclusion. Studying the large school complicates the effort to recognize students with SEN. The study has distinguished intellectual impairment as the main problem for recommendation to special schools. Students' background is essential in recognizing the need for SEN. Students who took longer time to progress in school were found to be in need of special education more than those who took less time. Children with SEN are not recognizable in schools that have many students. Students with SEN may not be noticed in schools that have a high number of disadvantaged children, or in schools where literacy levels are below average. SEN students in urban areas are more likely to be referred to special schools than in rural areas due to accessibility of the facilities. Handling literacy and numeracy problems may be tricky if the rushes to recommend students for special schools without recognizing special supports. The research failed to identify the difference between literacy attainment and the number of students with SEN because children are more likely to develop at the same rate in the same class. No definite expression can explain the problems that necessitated referral, as problems vary with student needs. Children with SEN should only be separate from other children except when the problems are too noticeable. The Dutch government can only provide for SEN adequately if it endeavors to know the exact number of students in need of special needs in mainstream schools. The researcher was also concerned on the type of problems that necessitated referral to special education. Intellectual impairment proved to be the most common problem that teachers utilized in making a referral. Intellectual impairments are apparent as they affect day-to-day activities of children and adults. If a child experiences communication problems and is slow in mastering language, he or she can be referred for special education in the Netherlands. Out of 8,237 students that were selected, 8,002 were interviewed. The vertical axis represents the percentage of students who were interviewed. The alphabets, A to I, represent the problems and categorized into 9 groups, which include A, being behind in literacy, reading, and/or numeracy. B, problematic attitude to work. C, internalizing problem behaviors. D, externalizing problem behaviors. E, speech, language, and/or numeracy disorders. F, intellectual impairment. G, physical disability. H, autism spectrum disorder. I, being gifted. The types of problems were also grouped into gender, boys and girls, maximum primary education, maximum junior education, vocational education, maximum secondary education, vocational education, and higher education. Out of 8,002 students that were interviewed, there were 4,636 boys and 3,366 girls. However, there were more girls than boys in terms of students that were behind in literacy, students that exhibited internal problem behaviors. Other problems that were stated were proved to be more widespread among boys than girls. Low-level educations among parents contributed to high frequency of students that required SEN. Gifted students progressed faster in literacy and numeracy compared to other students with SEN. A critique of the article. The article emphasized on inclusion of students with SEN in regular schools and their literacy attainment. Students with SEN can learn faster in regular schools than in schools due to high levels of interaction and motivation. The research methodology is appropriate for arriving at the desired outcomes. Teachers usually focus more on intellectual impairments and cognitive needs in order to make a result for special schools. Teachers may fail to recognize positive attributes in students if they focus much on physical appearance. The Dutch government should know the exact number of students with SEN to facilitate their progress in attaining literacy and numeracy. The lack of adequate funds has also delayed the support for students with SEN in mainstream schools. The level of parents' literacy has been used to mark the time that students with SEN are enrolled in school. The article failed to consider parents' contribution towards recognizing children with SEN. Parents are not always assured of how children with SEN are handled in school in cases of accidents. Parents have reservations that their disabled children may be frustrated by other students who do not know how to handle them. Parents may not be involved in recognizing children's capabilities so that teachers can gain directives from them. And lack of equipment to handle students with special needs can affect their performance in mainstream schools. Children are likely to be referred to special schools if their disability problems are cognitive in nature. However, ignoring other special needs and concentrating on intellectual impairments may not be helping offering solutions for students with special needs. The article failed to point out problems that children with special educational needs encounter in mainstream schools. Children may frustrate students with educational needs because they do not know how to handle them. The article also pointed out that parents may contribute to low performance for their normal children or students without special needs if they focus too much on their children with SEN. The more the parents direct resources to SEN children, the other children would feel abandoned and fail to focus on their performances. Teachers may focus more on labels than real situations of children, hence failing to distinguish talents. Also, underestimating children's capabilities or capacities may not help children who have special gifts but stalled by their disabilities. Recommendations. The Dutch government should invest on future research to investigate the best method that teachers can utilize to select students that require more special education needs. More research is required to understand the appropriate methods of recognizing children with special education needs, since poor methods can affect their future careers. Involving parents in recognizing children with special education needs is vital for confirmation and to minimize fear of discriminating some students. Mainstream schools should employ counselors who would help teachers to recognize and handle students with special education needs. The Dutch government should endeavor to know the exact number of students with special education needs to avail the required resources in mainstream schools. In conclusion, inclusion of students with special education needs in mainstream schools is an essential goal that many countries are endeavoring to attain. Sustaining students' special education needs in regular schools is necessary for motivation and facilitation of social interactions. As students with educational needs progress in numeracy, the need to remain in mainstream schools rises due to the positive influence for other students who do not recognize specialized needs. Although teachers contribute immensely in identifying SEN students, knowing the exact number in addition to utilizing counselors in recognizing SEN students can assist to serve them better.